Are you getting a sharp pain in the back of the ankle or the heel that's worse after walking, running, or getting out of bed in the morning? If so, you could be dealing with an Achilles tendinitis. My name's Joe, I'm an ex-professional football head physiotherapist and now multi-physio clinic owner, and today I'm going to show you the most common causes of Achilles tendinitis, how to get rid of it, and more importantly, what not to do. Now, if you're dealing with an Achilles tendon issue, what you don't want to do is fall into the trap of just treating the symptom, because by doing that, by just treating the symptom with anti-inflammatories, medication, massages, you're only going to get short-term relief. And if you are lucky enough to get rid of the issue by just treating the symptom, inevitably it will come back again. Now, there are three really common causes of Achilles tendon pain. Number one is tight calves. There are two big calf muscles called the soleus and the gastrocnemius. They both join into the Achilles tendon, and when they're tight, they will increase the tension within the Achilles. And an Achilles tendon that's already pre-tensioned before you even walk or run on it will inevitably predispose it to overload, because there'll just be too much tightness and tension within the Achilles tendon. Once it's overloaded, there'll be an inflammatory response. The tendon will become swollen and inflamed, and a swollen tendon or an inflamed tendon will present with stiffness in the morning, pain or stiffness when walking or running after a period of inactivity that may warm up actually when you get into activity, but then will return with vengeance after the exercise or even later on during the exercise. So it's not uncommon for people to say, I go for a walk, it's really, really stiff, it warms up, then after 5, 6, 7K, it comes back again. So tight calves is a really, really common cause of Achilles tendon pain. The second most common cause of Achilles tendon pain is foot posture. So if the foot's beginning to overpronate, and I just want to add, pronation is not a bad thing, we need it, it's the way the foot shock absorbs, but the issues arise when the foot begins to pronate too much. And when the foot pronates too much, the arch will begin to collapse and the heel bone in which the Achilles tendon joins into begins to roll inwards. And the combination of the foot pronation and the rolling in of the heel bone puts enormous stress and strain through the Achilles tendon, which again predisposes it to overload. The third most common cause of Achilles tendon pain is just training load. So increasing your activity levels too quickly. And for some people, it might mean that they normally do 2,000 or 3,000 steps a day, and now they're doing 10,000 to 15,000 steps a day. For some, it might mean that they only run 5K and only ever have run 5K, and now they've decided they want to do a marathon, and they've gone up to 10, 12, 15 kilometer runs. And it's the lack of incremental load or too big of a jump in training load or a spike in the training load that overloads the Achilles tendon and then develops Achilles tendinopathy, and the tendon gets swollen and inflamed. So how do we get rid of it? Well, the first thing to note is if you feel that you may have some issues with the posture of your feet, and what I mean by that is you feel that you are an overpronator, you've got collapsed arches, or your heel bone's turning inwards, or you're noticing hard skin building up on the big toes or the heels, it's worth booking in for a biomechanical assessment with either a physio or a podiatrist. And what they'll be able to do is assess you in depth, have an in-depth look at the foot, the ankle, the big toe, do some 3D scans of your feet, do a gait plate assessment, look at the pressures and the way that you load during walking, and from there establish whether you're a candidate for an orthotic insole or not. The second thing that we do with all of our Achilles tendon patients is hands-on manual therapy techniques. So soft tissue techniques into the calf to release any trigger points, any tension, any contractures through the soleus, through the gastroc, and some deep transverse frictions, manual therapy work into the Achilles tendon, just to start to reabsorb any inflammation that's sitting around the Achilles tendon. And we often notice that our patients that have got Achilles tendon pain, they often notice an instant improvement and reduction in their symptoms even after one session. Now, alongside manual therapy, we use another form of treatment called shockwave therapy. Shockwave is high pressured sound waves. It's delivered to the main site of pain on the Achilles tendon with a small gun, and what happens is the sound waves that leave the shockwave machine pass through the Achilles tendon, and as they pass through, they start this healing and regeneration process, and it works fabulous. A few things to note: there's a maximum effect or a ceiling effect reached after 6 rounds of shockwave, so you don't need to be having 7, 8, 9, 10 sessions, because we know that the ceiling effect is reached at 6. The sessions need to be 1 week apart, and if you've only been experiencing Achilles pain for less than 12 weeks, you're not a candidate for shockwave. It just won't work, and if anything, it actually aggravates them. So you need to have been experiencing Achilles pain for 12 weeks plus. Another really important thing to consider for Achilles tendon issues is strength work. So calf exercises, Achilles loading exercises, because they're ultimately what are going to increase the durability and the robustness of the Achilles, of the calf, and stop you breaking down again in the future. Now, the way that I tend to do it is I start with isometric exercises, double leg to begin with, then progress onto one leg, and then once the Achilles is not reacting to that type of exercise, we then progress it, and we then progress to more concentric based exercises, again double leg, and then progress into single leg, and then more eccentric exercises. Now, there's a few things I want to note about Achilles loading, because people make some really common mistakes when it comes to eccentric loading the Achilles. Many people that experience any form of Achilles tendon pain, their first option is to go straight into eccentric loading, which from my experience, and I've seen a lot of these, they get worse. The initial phases of managing an Achilles tendon issue, for me, are more focused on manual therapy, shockwave, and potentially orthotics if there is some biomechanical issues, to drop the pain levels, reduce the irritation and the reactiveness of the Achilles tendon. And when people start to get to about 60-70% improved, then we start to drip feed some very basic low-level calf exercises in, which we then progress on the basis that the Achilles tendon isn't reacting. If you've liked this video, don't forget to like, subscribe, and ring the bell so you don't miss out on my future content.